Welcome to the Dental Handoff. I am Dr. Kelly Tanner. Today I have with me Lacy Walker, who is hailing over from Deutschland. Hey, Lacy.
Hello.
Guten Tag. Guten Abend.
Yeah. It's actually Guten Abend now. Yeah.
Yeah, it's nighttime for you. So thank you so much for coming on today. I have met Lacy a few times in passing at dental hygiene conferences, and it's been such a delight to get to know her and her story. Lacy, the question we always start with is why dental hygiene? Did it choose you? Did you choose it?
I honestly feel like it chose me. I was always at a young age concerned about, the whiteness of my teeth and my smile, because I didn't really smile much. I mean, even through grade school, they were like, "Are you okay? Like, you don't smile." I'm like, "Yeah, I'm fine." Just because of the, I didn't have orthodontics yet, and that kind of thing. But then while I was in high school, there was a work co-op program that they offered to send you off to certain, like an internship or practicum type things, to where you work and go to school as part of your grade. And there was a dental office that wanted to interview people from the business side of it for front office. But then when I got interviewed, they said, "Hey, we really need somebody in the back for assisting." I was like, "Okay." So I learned a lot about infection control that I had no idea the amount of information that you need to have for infection control.
Yeah.
How easy bacteria can be transmitted from one surface to another person. So yeah, I learned a lot on that. And then I saw, a hygienist working, and I was like, okay, that seems pretty cool. Like, I like what she's doing. She can work by herself. But then, once, my husband joined the military, but he joined the military before we were born, or before we were married. Sorry, please cut that out. Sorry. I was thinking about my kids at the same time. But he joined the military, and then we got married, and we traveled to a lot of different places. So we're not in a same place for very long for me to go to college. So I didn't go to college right after high school, like many of my classmates in high school. So once we got to a state that we were going to be at for a long term, which was North Carolina, we ended up being there for 15 years. And so then we decided to, pursue more, dental hygiene. So they actually presented with a new dental hygiene program. And I was like, well, I don't want to go for the first class to go through. I want to make sure everything is kosher with it, make sure everything is passed and legal and everything. So I was like, okay, I'll do the second class. So I did my prerequisites, did all that. And I just loved dental hygiene from then on and wanted to learn as much as I could. And then I was introduced to oral and systemic health, and it just progressed from there.
Yeah. So how far were you into your career as a clinician before the oral systemic connection became like an aha moment for you?
I think about 3 or 4 years. 3 or 4 years, because I just had some patients that, I just felt like no matter how much I cleaned their teeth, it was just, they came back the same way every single time. I was like, there's gotta be something. And then I was in a practice in North Carolina. It was a DSO, and I had the opportunity to introduce new adjunctive therapies. Like, okay, can we try this? See if it helps the patient. And because I had one specific patient that it troubled me, and it still it reaches me to my core of, like, hygiene wise, like, your hygiene heart, you want to do something special for them. You want to take care of them, and you want to figure out why are they experiencing these issues with gum health. And the specific patient had, an oral systemic connection and high blood pressure, undiagnosed diabetes, and then she had a miscarriage. So that really ignited more of my passion to, like, okay, there's something here. So that's why I decided to become a fellow with AAOSH and learn as much as I can with them. I'm actually speaking for them next month.
Oh, cool. Which conference, or is it a study club?
It's actually a webinar, I think, in November. So yeah, feel free to look at that. And it's about basically on hydration and nourishment for optimal oral health.
Okay. Yeah, hydration is so misunderstood, I think, because we we think that we're hydrating, but our body's not necessarily absorbing what it needs to with the hydration because we're so dehydrated.
Yeah, I mean, it also depends on like how active you are, and then what foods you're eating, because there's certain foods that you would think are the most hydrating, but there's actually one that's better. So it just depends on how much water, or anything that you're consuming. So it all matters.
Yeah, interesting. So how has this changed, like your approach clinically, day to day? Has it changed what you're doing and how you've designed your approach to your patient care?
It has. I take a more holistic approach. I find out their daily activities, what kind of foods they eat, their activities, are they sleeping well? And do they have any airway issues? Because I was first introduced to airway issues because of my youngest daughter. Because she ended up having enlarged tonsils. She was choking while she was breastfeeding and not sleeping through the night, grinding her teeth. So I was like, okay, this is oral health. I should know this. And this is 17 years ago. She's about to be 18 in about a week. So she was always struggling with, breathing and sleeping, eating things and choking. So I was like, okay, there's got to be something. And then I came across not just about enlarged tonsils, but then enlarged tongue with some of my patients. So the Ballin-Potty score, and then the Brodsky scale, how big is your tongue or how big are your tonsils? And then, my daughter's tonsils were a great, like 4, like they were kissing. So that was, so that's why she wasn't getting enough oxygen. And then, the dark circles under her eyes every single day. And, they've said that, if you're grinding your teeth at night, that's your body's way of waking you up to get oxygen. Like, hey, wake up, you need to breathe. So that kind of really ignited my passion for us, like a holistic approach. And actually, my oldest daughter, who just turned 21, she was actually my first patient in hygiene school.
Wow.
So, yeah.
So with I'm assuming that your baby, your almost 18-year-old, or
18 to 21, now.
That at a younger age, did they have tonsils out, adenoids out?
Yeah. So the youngest one had adenoids and tonsillectomy. So she had those out, and she has been thriving ever since.
So dark circles went away, all of that.
All of it.
What? Yeah, it's a miracle. Like when you give the body oxygen.
Yeah, you need air. Air, water, everything.
How long did it take after that procedure for her to feel like she was rested? Did you see the difference in the circles under her eyes and all of that?
Yeah, I mean, obviously it was about 17, or no, not 17, but about 15 years ago. She had them out when she was about 3 or 4. But yeah, it was a significant difference. I mean, obviously the first, like the recovery phase, it took some time. But I mean, within that month, like I could see a huge difference. And then she was active, more, not tired or taking naps or anything. So yeah, she was active.
Even now, when I see children who have the dark circles under their eyes and their
mouth breathing,
forward head posture, the mouth breathing, all of it, their body just trying to naturally open up their airway to get air because they're gasping, and then they're diagnosed with ADHD and different disorders and spectrums of things. And it's like, okay, start with air.
Yeah. And then start with food, because food, and that's the other thing I talk about too, is about certain like ingredients in the food. It's, I read something on social media. I don't know where I saw it, but it said invented food is not real food. So all these chemicals and dyes, preservatives, that can cause, like some research has shown that they can cause, autism and ADHD and other, conditions that if we remove all that and just eat organic, farm raised, fresh food, organic food, pesticide free, we would be better.
Right.
But I know it's hard in the day-to-day life that we are in now. So
yeah, everything is just so convenient. It's headed to a ball game, going to school, grab something, going to work, grab something. But
I'm guilty of that too. So
what?
So I'm guilty of that too. So I'm not perfect. So.
Oh yeah. I mean, Gatorade is a big one. I remember the aha moment when, after sports when all three of my children were younger, and it would just be like blow pops and all the things after, and Gatorade and sugary this, and even giving out sugar at school as rewards. It just, I mean, not that sugar is bad or to vilify that, but you know what I'm saying. They're getting it from everywhere. So I think even as hard as we try to not restrict, but to encourage certain eating habits within our household, they're finding it.
Yeah, everywhere. I mean, sugar is everywhere, but there's like the right sugar versus the wrong sugar.
Yes. Oh, right. All right. So holistic chair side. So you're asking about nutrition, activity, intake. Do you ever find yourself doing a nutritional 3-day diary?
I've done that before for myself, just to kind of see. So my daughters are like, kind of bringing this up because I tried every, not diet, but just a different way of eating, like gluten-free, FODMAP, Mediterranean, all those different types of ways of eating, just to, all right, let's see, like gluten-free. Like I tried that. My daughters were like, Mom, seriously? But the thing about gluten is, like, here in Germany, I can eat the bread because it's all fresh. It's not preserved. But as soon as I eat preserved bread, I start getting congested and just bloated and all that stuff. So I try to avoid that. But, trying those different ways of eating, that has kind of given me a different perspective on understanding patients' health, of what can they consume that doesn't cause any adverse effects. And then, try to develop a plan that helps them.
Yeah. Do you feel like that? I know personally, I feel like that my health journey and my own experience with my children and allergies and all the things has helped inform how I care for my patients and information I'm providing to them. Do you find that for you and your patients sometimes end up with more questions, and then you say, hey, maybe you should go seek a referral for that? Do you feel like you're in that position?
Yeah, because there's sometimes, the first time I ever heard of FODMAPs were from a patient, and she brought, a list of foods she can and cannot have. And so I was like, okay, now I need to do research on this way of eating, because I was not educated enough. We are not taught as much that I think we should be in hygiene about nutrition. Like we're told about the different, vegetarian, or just different types of ways of eating, but not in depth of how it can affect the oral health and systemic health. And maybe, if people that are interested in that they should take another nutrition course more in depth. That's just my opinion. Like, I want to know more about what foods I'm eating, what vitamins, minerals can help long term.
Because I know, and I think the majority of hygienists in North America have all taken an additional nutrition course. It's one of our prereqs to get into hygiene school too. So, we get that, but then all of the things that come from personal experience, like you can hear, okay, this works with, you've heard this with certain blood types, that certain blood types, their bodies are better on these kinds of food. It's better for this. And then as we learn more, just keeping up with it, to what I end up saying is, there's no one size fits all. But the best thing to do is to go to your doctor or a functional medicine doctor or a nutritionist to get your personal blood panel drawn for that, so they can dial in exactly what you need, because what you need isn't what I need.
Exactly. And you heard about the glucose monitors, like it,
yes,
I don't have one, but I've heard great things about it. So that's definitely another option to see if your blood sugar is rising and uncontrolled. Then that can be something that you can follow or track. But I definitely believe in like optimal sleep as well.
Oh, for sure. That's where it starts.
Yes. If you're not, like, I've always heard this phrase said before by multiple, clinicians or, other colleagues saying, if you're not sleeping well, you're not healing well. So that is what I believe in too. And if I don't get my optimal sleep, you may not want to talk to me anymore.
Yeah.
I want my sleep.
Yeah.
I'm not my sleep.
and I think it affects us. I remember when I had my daughter, and it's funny because I was working at the dental school. It was when I was a baby hygienist, and I just had my daughter who's 20 now. And I remember asking myself, am I going crazy? Because I felt like I was getting sleep, but it was interrupted sleep. It wasn't quality sleep. I was up nursing and taking care of her. And there was Dr. Ellen Byrne was at VCU, and she's a pharmacologist. And I said, Ellen, am I losing my mind? What can I do for memory? What can I do for this? And she said, Kelly, it's your sleep. Your sleep is being interrupted, and it's the quality of sleep that you're getting. You're not getting your restorative sleep. And I was thinking, but I feel like I'm sleeping, but it played. You don't realize, because your body adapts to make your new normal, and you don't realize how sleep deprived you are.
Right. And because you don't think clearly or eat as healthy as you would if you're sleep deprived, because it's like your body's craving certain foods after that just to keep you awake. But then it's kind of the opposite effect. It's not really helping.
Yeah. I think it goes into, and then that played into weight loss and weight gain. And like you said, the cravings, and your body goes into more fight or flight because it's not going into that restorative state. So the decisions I was making, I just felt like I was foggy, that I wasn't myself. And I said, what type of nutrient am I deprived of? She said, sleep, just sleep. And I'm like, but I feel like I'm getting it. And the illusion of that your child's actually getting into some type of rhythm when they're an infant is crazy.
Yeah. Yeah, I've definitely I've also done some research on different types of eating disorders too, because I didn't realize I had one until it was pointed out to me, a couple of years ago. Oh. And yeah, so that is a kind of a emotional topic sometimes, but I've kind of grown to grow from that and learn from that and educate others from that. I don't know if you have time to kind of discuss that. Or
yeah, sure. If you as comfortable as you feel.
Oh, okay. I kind of explain it in my book that I wrote about choices, because I feel like words and food are influential and can affect your mental and physical health as well. Because the words you say can affect somebody's mental health. The words you choose to consume affect your longevity of life. And I basically explained, I'm going to try to be brief, but when I was about 7 years old, someone told me, at the age of 7, you're like, you don't care about figures and that kind of thing.
Yeah.
You're just a good kid. But then someone told me, that, hey, you better suck in your gut because you look like you have a root beer belly. And I was like, well, I grew up in the South, fried fish, hamburger helper, what they thought was considered healthy of other foods.
Right.
But then I was like, I don't think I have a root beer belly, but I was like, okay. And then I think that kind of just stuck with me for years and years. And then seeing other people have medical issues, a lot of medications, struggling to even bend over to tie their shoe. And I'm like, oh gosh, I don't want to be like that. And I want to be active. I see all these people just running around, but then I started getting to more anorexic looking. And my husband's like, he came back from a 7 months deployment. He's like, I love you, but don't ever get skinny like that again. I dropped 20 pounds in 7 months because I was like, man, I feel great. I can be, the smaller the size, the better. The smaller, amount I eat, the better. Just because I look thin, even though my hair was breaking and it was just unhealthy. I just was thin, and I thought that was great. But then I got introduced to, CrossFit type or obstacle races, and then I understood, okay, muscles are not that bad. I'm not going to get bulky. I'm not going to get big. And so I started delving into those obstacle races and getting more endurance training, and understood how nutrition helps, not just physically, but, oral health, mental health. And that kind of really guided my trajectory towards a holistic approach of nutrition and understanding of that.
Wow. So what foods, I know that you said that you were eating smaller sizes. Did you say that you were avoiding gluten at that time? What were you avoiding during that time?
So I had, I went to an allergist to find out because I was always constantly congested and sneezing a lot every single day. And even after I went for a run, like as soon as I would stop running, that's when it would hit me. Like I would start sneezing and just be miserable for like hours. So I did an allergy test and took allergy shots, two shots in each arm, every visit. And then about a year or two later, I was like, gosh, why does it still hurt every time I get a shot? Turns out I was allergic to the preservative in the shot. So I was allergic to preservatives. So then I started staying away from preservatives, and then we fixed the shot and just kept, going on for that. But I feel great now. So it is just, a lot of the allergies, and that kind of helped me understand what certain foods I can and cannot eat.
Mm-hmm. So it was medically guided. Mm-hmm. And so then you learn to adjust what you were eating. And then you hope that your body builds this immunity to it and eventually it goes away, right? It stops attacking it.
Yeah. So I'm not like allergic, but just highly sensitive to certain things like eggs, which I eat eggs every morning. So it's one of those things. It's just kind of acclimating your body to certain things. Yeah. I guess under, medical advice as well, but.
Right. Well, I'm sure that was a pretty big aha moment for you to say, this is what my thought process was. And for your husband to come home and say, hey.
Yeah. But the other thing is that I was like, okay, I hear you, but it didn't really flip a switch of what I was doing wrong until, and I also mentioned this story in the book. That's kind of what made me want to write it. Is my oldest daughter, she just came home from college to visit. She lives in the UK right now, and she came home to Germany to visit. And the speech she gave to me right in the middle of the restaurant, that hit home. And I understood what I was doing. And that was only a few years ago.
Wow.
Yeah, it was a couple of years ago when she said that. And I was like, okay, I realize what I'm doing. Because it's affecting them, the way they eat.
Of course.
And how, what food choices they do because of what I choose. And I was like, oh gosh, I didn't realize what I was doing to the family, based on my food choices. So, yeah.
What is the name of your book, Lacy?
Choices.
Choices.
But you may have to put in my name and choices at the same time. And I'm not the other Lacy Walker that's in there. So the family, I didn't know this, but there's another Lacy Walker, but spelled differently,
Oh, wow. Okay. Good to know.
Yeah. But I'm in the process of writing another one, but we'll see.
Okay. Well, look at you.
It's not the best. It's up here, over there, but it may not be the best, but it kind of was therapeutic for me to kind of get it out. Maybe it'll resonate with somebody.
Yeah. Well, it was meant to be put out. That was your path. It was your story to tell, and you told it. So what are you doing now? I know you're speaking, you're still doing clinical. What are you up to these days besides writing?
Yeah, lots of writing. So let's see. Yeah. So basically speaking, writing, still working with the podcast I've been with for about 5 years. So I do the continuing education portion of it. Just a lot of writing right now.
Yeah, I don't think it ever stops.
No, reading, writing.
Consuming information, saying, I need to know more. And then you start, I feel like the more that I learn, the more I realize how much we don't know yet.
Yeah, I like to research.
About that? What about that?
Yeah, it's just, I like to research the more difficult, challenging scenarios of a patient. Just like, I want to figure this out. It's like a puzzle. You want to put all the pieces together to, figure it out. It's like trying to be like I don't know if you understand, like the DOs, like they go figure out the problem based on not just put the prescription in front of it. Like, okay, why are you experiencing this pain, or why, finding out the why and going from there. So it's like, I try to take the approach of a DO of hygiene is kind of what I go through. Yeah. It's like, okay, why do you have bleeding gums? Okay, let's go from there. What is your nutrition? What are medications? So like that holistic approach.
Yeah. Like not just doing this, and it's not just only looking at 2 or 3 things, it's looking at everything. I heard someone say this one time that her son was in a DO program. DO was the beginning of doctor. And so she said that's the only real kind of doctor program there was, or the DOs, because they figure out the why and they're not just throwing medicine at it. I thought that was an interesting way to think of it.
Yeah, I think I like that approach, is to find out the why and like what pathogens are we dealing with, and
Yeah. What are the
Yeah.
risk factors? I mean, that's what we were taught in hygiene school. What are the risk factors? But I think that we can tend to get so spun up in what is just right in front of us that it's not just a class 5 carious lesion, number 2 DO. It's
Right.
okay, why is it even there to begin with?
Yeah, they're their person. Like, we need to help them, not just, all right, I only have 30 minutes or 45 minutes. And luckily for every office that I worked at is we had always had an hour for, repairing maintenance or, repair. But I always tried to be more, sufficient with my time, of asking questions and kind of delving into that, and even spending time like, hey, do you mind if I call you to find out more so I can understand? I took time out of my day or my lunch hour, just because I want to know why. So it helps me, and, obviously helps the patient, but it educates me in the same process.
Yeah. And I think when you do that too, you're following up with the behavioral changes that they're making. And it's like an accountability partner for working out, right? Where you're going, okay, how's that working out for you? What do you need to adjust there? Does that hurt when you do that?
Does this work? Will you do this? It's all those, like home, the aids that we give them of like, okay, electric toothbrush versus manual versus interdental aids, those kind of things. So what works for them? It's like catering it to their needs, right, and their abilities.
It's going to be what they use. It's not going to be what works best for us. It's going to be what they will actually use and what's easiest for them, I think, a lot of times. Well, Lacy, thank you so much for sharing your story. It's been enlightening. If you guys want to get Lacy's book, there'll be some information in the show notes, and it's Lacy Walker, and it is Choices. And make sure you got the right Lacy Walker when you're choosing the book.
Without an E.
Without an E. Good to know.
Well, thank you so much for having me on. I appreciate it.
Oh my gosh, it's such an honor. I hope to see you soon again in person.
Yes.
When we're under the same roof again, potentially.
Yeah.
But so thank you for being on. And for all of our listeners, thank you so much for all that you do every day. And you know that I always ask, go on over to Apple Podcasts and give us a 5-star rating, because Apple is the rating that matters. Go on over to then YouTube. Push the like button. Do it right now. Subscribe and share it with folks who you think will love our message. Thanks for all that you do. We'll see you again next time, family. Sending love.